Dr. Blake Staker here. Today we're talking about how the lumbar spine or the low back here is injured in rear end automobile collisions. So what happens is when the vehicle is struck from behind, the vehicle continues moving forward while the person initially stays still. So as the vehicle moves forward, the person actually slides up in the seat, and then when the seat springs forward, the spine actually acts like a whip, because the spine is slid up, it's in a loose packed position. Then that whipping action is where you have the injuries of the disc, as well as, like back here in the joints, the tissues through here, they undergo a sprain strain. So factors that play a role in the injury are speed, of course, but also acceleration. You can have disc injuries in the low back at speeds as low as 8 miles an hour. So if you're sitting at a stop sign, somebody hits you, you're going to have that quick acceleration. The acceleration a lot of times is so fast your reflexes don't have a chance to stabilize the spine, so that's going to add to the further injury. So here in the office, what we focus on is we want to first address the disc issue, because like I said, those discs can be injured with the whipping action. Also we want to address the scar tissue in the low back through here that forms from the injury. So with the disc, what we want to do is we want to increase the circulation. That brings oxygen and nutrients to the disc so it can heal properly. And then back here with the scar tissue, you want to traction it through its full range of motion. That makes sure the scar tissue gets laid down properly so it can stabilize the area and doesn't restrict the motion. So we like to use in the office, we like to use the reverse hyper here. We use it for a couple reasons. With the action itself, it promotes circulation to the disc, because when you lift the legs up, it compresses the spine, and you drop them down, the traction increases the fluid to it. But also the full range of motion really helps with the scar tissue formation in the lumbar spine. So we'll demonstrate here. So if somebody hop up here on the table, you want the pivot part to be right around the head of the leg bone of the femur. You want to grab here the handles and keep the lats tight. Go strap across their feet. We're going to go through this full range. So this part here, this contracts those low back muscles. It compresses the disc, and then you drop the legs down, it tractions it. And that's the circulation aspect. And then as you go through the range of motion here, this posterior hip rotation is going to stretch out that scar tissue in that lumbar spine to minimize and help manage the healing process. So this is what we do in our office here. We probably do about 3 sets of 10. We start with our body weight first, then we progress up through the weights. So hopefully that helps you guys out.